Well, India has recorded another grim milestone, passing 300,000 COVID-19 deaths. The crisis is now spreading into neighbouring countries, Nepal and Bangladesh, causing local charities to scale up their response. Joining us live is Michael Annear, the Director of International at the Australian Red Cross. Michael, appreciate your time. We have all heard a lot now about India's COVID crisis. You're really raising the alarm about Nepal and Bangladesh. How bad are things getting in those countries?
Thanks, Ash. Yeah, indeed. Our concern is right across the whole South Asia region, where at the moment we see 3.5 million active cases. And as you mentioned, in total there's been around 324,000 people having lost their lives. Particularly, we're concerned about the impact in Nepal at this point in time, where in the recent weeks we've seen the daily peak number of cases reaching more than 9,000. And the number of positive test results coming back in early March was around 2%, whereas today we're seeing 40% across the country. Our operations in Nepal are really focused on the densely populated Kathmandu Valley surrounding districts, and then along the Indian border, where we see that the health authorities are really struggling to cope with the increasing demand on their needs and the number of cases presented at their facilities.
Yeah, so what sort of reaction have we seen from the government in Nepal? I saw that an official said this week that many foreign climbers are continuing their attempts to summit Mount Everest despite the reports of a huge outbreak at the base camp. Now's probably not the best time for people to be living out their mountaineering dreams at Mount Everest, but what sort of government response have we seen?
Yeah, so we are aware of the media reports about the case at the base camp on Mount Everest. But overall, what we're doing with the Nepal Red Cross is working alongside the local authorities to help reinforce the work that they're doing in provision of health and community awareness. So what we're really encouraging is for Nepal Red Cross and the local authorities to get out amongst the community to promote the really important health and hygiene messaging, to create awareness around the impact of COVID-19 and practices that people can take to protect themselves and their families. So alongside in any mass location where a lot of people are situated, we're really encouraging people to use masks, maintain their hygiene practices and practice social distancing where possible. Nepal Red Cross is reinforcing this with the rolling out of vaccines across the country and increasing health facilities, particularly along border posts, where they're supporting the overwhelmed health services in providing people who are presenting with COVID cases to help triage, provide support, and then create awareness once again about what they can do, not only when they enter the health system, but back within their families to make sure that they keep themselves and the community safe at this time.
You mentioned the vaccine rollout. What is supply like in places like Nepal?
Yeah, so in Nepal, the government has launched its vaccine rollout since January of this year. And unfortunately, only 2 million people have received the first dose of a vaccine as of today. In total, 300,000 people have received both vaccines. So the vaccination rate is quite low at this moment at around 1%. We are concerned at this point in time with the ongoing access to vaccines for countries like Nepal and others around the world. And we're really encouraged by the work of the Australian government, which has invested in the global COVAX facility to help support the equitable access to vaccines, as well as the provision of vaccines directly through our bilateral partnerships to countries such as East Timor and PNG closer to home. But overall, we encourage governments and pharmaceutical companies to work together to see how we can set up manufacturing and supply of vaccines at the locations where they're most needed, not only here in Australia, but across the region, particularly in countries such as Nepal and Bangladesh at this point in time.
Michael Annear, we appreciate you joining us. Best of luck with all the work you're doing in that region. Thank you so much.
Thank you.